Have you been told that your painful periods are just normal? Or maybe you have been told that you just have a low pain threshold. Then this video is for you. In this video, I'm going to discuss endometriosis and its profound impact on infertility. This is not just about bad cramps. It's a disease that affects your body and requires treatment and can also cause profound effects on your reproductive function. So one will ask, what is endometriosis? Endometriosis is whereby the tissue lining your uterine cavity, that is called the endometrium, is growing in the wrong places. It's growing outside the uterus. So it could be in the pelvis, in the ovaries, in the fallopian tubes. And what happens with endometriosis is that this similar tissue is responsive to the hormones in the menstrual cycle. So every month, this tissue will also grow just like the endometrium inside the uterus and shed during your periods, just like how you're having your menses. And now, every time this is happening, it results in inflammation, and this could be the reason why your periods are very painful. So I'm going to discuss how endometriosis can result in infertility. Endometriosis can result in tubal blockage, especially if this endometrial tissue is inside the tubes. So this can result in scarring and damage and blockage of your fallopian tubes. Another thing is that endometriosis, if it's involving the ovaries, there can be cysts in the ovaries. They are called endometriomas. So when there's a cyst developing in the ovary, it can affect the normal ovarian tissue, thereby affecting even the ovarian reserve. What endometriosis does, it poses a toxic environment in the pelvis and even in the uterus. So this inflammation process is toxic to the sperm and toxic to the egg and even the embryo. So it can affect implantation, it can affect fertilization as well. So these three factors are the major contributing factors to infertility if someone has endometriosis. So now you have been given this diagnosis at the doctor's office and you're wondering, what are your treatment options? So the major treatment option for endometriosis is laparoscopic surgery. This is a minimally invasive surgery where cameras are inserted through the abdominal wall and the endometriotic tissue can be resected or ablated in that manner. But now when you're specifically treating fertility, then mostly IVF has been proven to be a very effective treatment option for endometriosis. So what IVF does is the eggs are fertilized outside the body, and now we are eliminating the toxic environment that would affect the eggs and the sperm in the pelvis when someone has endometriosis. So in IVF, fertilization happens in the lab, and these embryos that are created are directly placed inside the uterus for conception. An endometriosis diagnosis is very overwhelming, and you need to know that the pain was just never in your head. But it's not the end of the road. You can still achieve your parenthood journey. If you have endometriosis, please share your journey in the comment section to encourage someone. Subscribe and join the community. Let's change the conversation around fertility.